Then when I'm working in this area, I have to avoid the thyroid, which is in this area, right? And it'll be like this. How is? Okay?
Yeah.
I know you feel a little bit discomfort, but just imagine like I am now producing columns of damaged tissue there, which then in future will trigger a new formation of collagen. Doesn't take too long to finish to this depth. Okay, now I move. You can stop me anytime if you feel too much discomfort.
No, it's comfortable.
Good.
Right? Yeah.
We try to avoid hitting nerves or important structure in the skin, and therefore we go on the safe areas only. Yeah. Now, again we start. As you can see, I'm going now up to pull up. Yes?
You're pulling up the skin.
I went like from down up, yes? And in the same time I try to do another line like this. To give a nice defined jawline.
Okay.
The other side. And the tissue. Sometimes the patient might feel in one side more pain than the other side.
Yeah. Why is it like that?
This happens because usually the pain center in the brain already is tired from getting the damage, on the other side, kind of pain.
Okay.
Then the other side
So it's
seems to be
alarming
a
more.
little bit alarming more.
Yeah.
Yes. But it's not, because we use the same power, we use the same frequency of the shots. Only for some cases happens this. The distance between lines, injured lines of Ultraformer, has to be about 0.2 mm. Not too dense, to be too much damage, and then will cause problem. But not too far from each other.
Okay.
Too. Then it's important somehow to calculate the density of the injured tissue. It's a little bit thicker. The texture of the skin is different comparing with the under the chin, submental area, or neck, or around the eyes. Then we have to consider everything, even the bony area. It's absorbing more the energy we have to avoid because it's very painful.
In the bone area.
In the bony area. Then, therefore, when I am on the jaw line, I pull the skin up, not to hit the bones. Now, I'm changing the transducer. This one's the deepest one, like 4.5, the depth. Now we will go like 3 mm in the depth. And then in this case I can work on the neck, and I will be able to work around the eyes and the nasolabial fold and even here, because we'll be safe not to hit the important structures in the skin. Is okay?
Yeah.
Then again, I will avoid trachea and the thyroid, yes?
Yeah.
I'll decrease even more with the power on the neck. Skin is a bit thinner.
Yeah.
The beautiful part of this procedure is that the patient doesn't have downtime. As you can see, they feel the pain, but without giving any other sign outside. Means can be done in a lunch break. In the same time, very confidential, very private, very secretive. For the family, for the work environment, let's say, if you just want to have something without being noticeable for the people surrounding you.
They notice the big change, but they won't notice.
Yeah,
what
they are
exactly.
asking what happened with you. You look fresh, you look good. And the most important is in the morning to wake up and to say, okay, I look good, my skin is not sagging. It's less sagging here, there. For this type of procedure, it's not important the skin type of the patient, like with other lasers, or the pre and post care rules. As you know, like with most of the lasers, we will ask the patient, don't go in the sun before, don't go after. This, because it's ultrasound and it's not a laser actually, doesn't have these strict rules of before and after. It's simply you do it and you just continue your life normally. If it's possible, of course, you have to help the skin by applying good creams or taking some collagen tablets or powder, if it's possible, yeah, to sustain a little bit the new formation of the collagen. But otherwise, your life won't be disturbed by the procedure, life routine.
The skin color or anything, it doesn't make any
Doesn't
difference.
affect. No, like with other procedure where we have to be very carefully on the post and pre-care rules. The skin is normal, won't be absorbed that much, but her skin is absorbing immediately.
So she needs more moisturizing cream.
Yes. We used to say that if it's applied once in the morning, it's enough. But depends on the season, on the lifestyle, yeah. Then it's better to be reapplied sometimes after a few hours again. Of course, if you have makeup, it's difficult on top of it. Our aim is to reach the point of giving the patients treatment which they won't need in future then to use any makeup. They will be happy with their own skin. And just a little bit mascara
Yeah.
and lipstick maybe. That's it.
Yeah, lipstick is a
Without-
must-have.
Must have.
Yeah.
Anytime, right?
Yeah.
But the foundation I am talking, the foundation is the one which is actually more dangerous for the skin because enters deep inside of the pores and it's suffocating them, right? Even the powder, it's a little bit easier. to be applied on the skin and the patient to have it. How beautiful is this that the nasolabial fold can be worked on it without thinking of applying, inserting the fillers, which is a foreign object, fine, right?
Yeah, sometimes fillers are moving under your skin, so the result, I mean, it's exactly opposite what you imagine.
And what you expect.
Yeah, what you
This
expect.
this is one of the side effects, but sometimes they might become encapsulated there, and then the patient can feel that it's having like a chicky there, something under the skin, right? It's still a foreign object, and sometimes the body's immunity will try to reject. It's normal. Then on that negative point, we are thinking, okay, I have a good immunity. This is the bright side of a side effect, let's say. Just a bit more. Yeah. Yeah. I really like this. It's okay?
Yeah.
A little bit I will go here. I'll give only like 2 shots here. Go with 1.5. A little bit more on the surface means I can work all over the face with no risk of damaging something. Yeah, for here, even for the upper lip, and again there. Yes. Bella. This again is a very common area to do the Botox. The frowning lines.
It is.
We feel free to work with the right parameters. Although we have to adjust with the pain threshold of the patient is true. Done.
Thank you very much.
You are most welcome. You are very great. How do you feel? Okay, right?
Yeah, okay.
A little bit, you will feel
Yeah,
pain
a little bit just I feel something hot
inside of
into
the
my
skin.
skin. Yeah, it's
But
okay,
this will
but
go-
it's
will
okay.
disappear.
Yeah,
Usual in about 2 hours, you will feel almost nothing.
yeah,
In the next few weeks,
yeah,
2 weeks, if you'll feel maybe a little bit when you are touching the skin,
yeah,
a little bit tenderness,
yeah.
it's not a pain, it's because you won't be conscious like, oh, I have a pain, yeah?
Oh, okay.
Only when maybe you will touch, or maybe when you will apply your night morning cream, you'll feel a little bit tenderness.
Yeah.
This is very normal, means it's working.